Dermatitis. The inflammation of the skin characterized by the erythema and pain or pruritus is called as a dermatitis. Types. It is mainly divided into four types: contact dermatitis, atopic dermatitis, seborrheic dermatitis, and exfoliative dermatitis. In contact dermatitis, it is the inflammatory reaction of the skin caused by the exposure to the physical, chemical, or biological agents. The main cause of the contact dermatitis include acids, alkali, soap, detergent, cosmetic, iodine, nail polish, lubricating oil, etc. The frequent contact with water and extremes of the heat and cold also predispose to the contact dermatitis. Clinical feature. It includes the acute phase, subacute phase, chronic phase. In acute phase, there is a itching, erythema, burning sensation, eczema, edema, formation of the vesicle, and oozing from the wound. In subacute phase, there is a crusting, drying of the skin, fissuring, and the skin peeling. In chronic phase, there is hypo or hyperpigmentation of skin become thick, and secondary infections. Treatment of the contact dermatitis. Local irritation should be avoided. Avoid applying soap over the affected area. Non-medicated skin lotions. Cool, wet dressing should be applied. Sometimes corticosteroid and antipruritic ointment should be used. Atopic dermatitis. Atopic dermatitis is the chronic relapsing prurite type of the inflammation of the skin. It is more common among children. Exact cause is unknown, but if there is an increased level of the immunoglobulin E, increased sensitivity toward the histamine, there is family history of the dry skin, asthma, or allergic rhinitis. Clinical feature includes red, oozing, crusting rashes, thick under dry skin, brownish gray color scale, localized rash. As the child grows older, rashes will mainly over the elbow, back of the knee, neck, eyelid, and back of the hand and feet. Management includes the lubrication, promotes oral intake of the fluid, IV fluids, allergen should be removed, wet dressing, antibiotic, antihistaminic, and corticosteroids. Seborrheic dermatitis is a chronic inflammatory disorder of the skin which involves the scalp, eyebrow, eyelid, ear canal, axilla, and trunk. Causes include exact causes unknown. Patient who is taking methyl-dopa in case of Parkinsonism disease, hypertension, or AIDS patient. Clinical feature include the formation of the yellow or white plaque with the scale and crust, mild pruritic, dandruff, and the erythema of the scalp. Management include proper hydration of the patient. Lubrication should be applied, maintain of the personal hygiene, antibiotic and corticosteroid if required. Exfoliated dermatitis is the skin disorder which is characterized by the excessive peeling and the shedding of the skin. Exact cause is unknown. Risk factor includes the psoriasis, pediculosis, lymphomas. Clinical feature includes the fever, weakness, malaise, chill, weight loss, scaling or peeling of the skin, pruritus, erythema, hair loss, nail loss. Diagnosis can be made with the complete history taking, history of the allergens, family history of the skin disease, or use of the medication should be collected. Scratch test and intradermal tests are used to find out the allergens.